My name is Ambles Adabo. I'm a group leader of I'm in 8A. I'm going to be doing a presentation or defense of first aid box. And under this, we'll be looking at the introduction, definition, ABCs of first aid, components of first aid box, application of first aid on a victim, conclusion, question and answer. A first aid box is an immediate assistance given to a person who has just been ill or a person who has been injured while waiting for a doctor. Now, a first aid box, and under a first aid box, I'm going to be talking about a first aider because without a first aid box, we cannot be able to carry out application of first aid on a victim. Now, a first aider is a person who is well trained and equipped to handle first aid equipment and its instruments inside the first aid box. Now, the importance of a first aid box, it helps save life, it minimizes injury, it gives emotional support, it prevents infection, etc. Now, the ABCs of first aid. The A stands for airway, B stands for breathing, and C stands for circulation. For airway, check if the person's airway is blocked. If it's blocked with either vomit or blood, try cleaning it up with a cotton bud. B stands for breathing. Check if the person is breathing normally. If he's not breathing normally, try do CPR, cardiopulmonary resuscitation, or mouth-to-mouth respiration. Circulation. Check for the pulse. Feel the person's heartbeat and check if the blood is circulating around properly. Now, the components of a first aid box. Inside a first aid box, we have various components used to attend to first aid accident victims. We have the hydrogen peroxide. It is used for cleaning up wounds and antibiotics. We have the moco iodine. It is used for disinfecting small wounds and open wounds. We also have the Denton violet spray. It is essential for cleaning up of blisters and wounds. We have the bandage. It is used for applying to fractures and cut and broken limbs. Plaster. We have the plaster. It is used for it's also like a bandage, but it is used for covering of open wounds. We have tablets, which a first aid victim can also take in case of any first aid problem. We also have a methylated spirit. This is used for cleaning wounds. We have cotton bud. It is an absorbent material used for cleaning of wounds, and it's also used in the hospital. We also have hand gloves. The first aider must wear a hand glove to prevent infection or prevent spreading of germs. We also have nose mask. He must cover his or her nose for any other procedures or whatever. Application of first aid on him. Now, first aid can be applied to a victim who has a snake bite. After you call 911 or any local emergency number, try follow the steps. Check if the person's airway is blocked. If it's blocked, try cleaning with a cotton bud. Check for the person's breathing. Check the breathing. If he's breathing normally, and circulation. Check if the person's blood is circulating around normally. Then, and make the person to sit up. Check if the person is responding to any of your first aid medical assistance. If it's not responding, then make the person to sit up. Then do CPR if it's not breathing. Then, after when the doctor arrives, don't try to catch the snake or use whatever thing with the snake. Just from a safe distance, take the photo of the snake to know what kind of treatment you admit yourself in the hospital when the doctor arrives. Now, in order to carry out first aid operation, we have the DRSABCD plan. The D stands for the danger. Clear the danger area. Let the danger area be free from more dangers. Then the R, check for the response. If the person is responding very well. If the person is not responding very well, try to make the person respond. Then the S, check, send for help. You can call the 911 or tell any person or anyone close to you to do so. A, airway. I've already said airway. Check if the person's airway is blocked or open. Then B, Breathing, to check if the person is breathing normally and has air going in and out of his body or the lungs. Then the C, circulation. You also check if the person is breathing. If the person is not blood not circulating or the heart is not beating, you can try do heart compressions or mouth-to-mouth respiration. For example, 30 compressions to two rescue for an adult. Then the deterioration, allow the person to be well deteriorated and sit down in a very comfortable place. Now all what I've said, and I hope I cannot be able to defend this first aid box, that first aid box is useful because first of all, without a first aid box, you cannot be able to attend to serious or simple injuries like cut or burns. Now first aid box has a golden rule which says that you must not risk your life trying to save others. One. And number two, you must not prioritize anything. Number three, you must remain calm and have a faith of saving that person. Then, now with all this I've said, I hope I can be able to convince you that a first aid box is very essential, and we must also have it in our homes, and also we must also have it in anywhere like our school, our office, etc. So I hope I'll be able to convince you. Thank you. Now, any questions? Yes, Glory.
How can we apply first aid on the road accident victim?
First of all, you can apply first aid on the road accident victim by one, clearing the road. Then make sure that the person is not overcrowded to help the person take in oxygen and release out carbon dioxide. Two, help the person in case of a car accident, the person is trapped in a car accident. You can use some equipment and remove the person out and bring it and perform your first aid operations. Three, if the person has a broken limb, apply bandage or plaster bandage to apply pressure. Then if the person has a serious bleeding, you not apply too much pressure on the person so that the bleeding can stop, and then don't remove any tight things so that you can apply pressure. Then feed the person a little bit, allow everywhere to be full of air so that, and make sure the area is safe, that it cannot cause infections to the person. Thank you. Next question.
What's the meaning of CPR?
Cardiopulmonary resuscitation.
What is it used for in a first aid treatment?
It is used for helping a person who has not had his normal breathing start breathing by pressing his chest. For an adult, like I already said, then the compression for two rescue for an adult to help the person regain his normal breathing posture. Yes, good. So now time to ask my questions. One person from here should tell me how to apply first aid on a person who has a serious stroke. Great solution.
Apply a first aid treatment on a stroking person by